Well, hello, everybody. My name is Pam Kovar, and I am coming to you guys from the Dallas, Texas area. I am a registered dental assistant and practice administrator for Fisher and Zittrick Dentistry. I've been practicing dentistry for 21 years now, 21 years this summer. Just a quick little disclaimer. I am being compensated by the wonderful company Show Food Dental. They've been so generous to do that for me tonight. And you'll see I do use a lot of their products, and we're going to go through a lot of those things tonight. I'm so excited to share that with you tonight. All of these slides here coming up, I have created. They are my opinion and my opinion only, and only to help. And that is the purpose of tonight. It's just been all of these experiences and this data gathered over these 21 years. And gathered from some of my most favorite mentors and colleagues. Big shout out to Shannon Brinker. You'll see some information that I've gathered from her in the years past. So just so many doctors and mentors that I've had over my career. So just a lot of things that I'm excited to share with you tonight. This is where I get to practice every day. This is my awesome team, my awesome doctors in Rockwall, Texas, which is just a suburb of Dallas, Texas. You'll see the famous wings behind us. Kelsey Montague, who is the famous artist who did the Nashville Gulch wings, came and did some wings on our new building, which is actually not so new anymore. It feels new because it was built, our practice was built just in 2020, right before the world shut down. So we have some fun little dental hidden tools and pictures in those wings, which is fun. Just a little bit about me. I did start dentistry in 2003, so I have been doing this for a little while. Started when I was a baby, so we're just going to keep it at that. I am an expanded function dental assistant, have been since 2005 in the state of Missouri. I do hold, I believe, 5 or 6 licenses in the state of Missouri. I can place class 1 through 5 fillings, submit permanent crowns, have my ortho expanded function. So the great state of Missouri actually allows dental assistants to have a lot of freedom and flexibility with the proper training, which is super exciting there. I did move to the Dallas, Texas area in 2016. Love Texas. I had to become an RDA in the state of Texas, so I did that in 2016. And I have been a clinical and practice administrator pretty much my entire career. My joy and passion is just going into practices and making them better and making them more productive, more efficient, getting happier, healthier cultures and happier and healthier numbers. I am a national speaker and educator for the Academy of Chairside Assisting. So if you have not checked that out yet, dental assistants, I highly encourage you to do that. Shannon Pace Brinker is a great friend and mentor to me, and has been to hundreds of thousands of dental assistants and contemporary product solutions as well. I have treated over 5,000 Invisalign cases. I've worked for diamond and platinum providers. Currently, we went from, in Rockwall, in my practice there, grew that practice from maybe 10 cases a year to well over 100 now per year. And so that's exciting. And so we're just thriving in that right now in Rockwall. I am a co-owner of a company outside of dentistry. So I do have a creative outlet outside of dentistry, which is fun. And I do get that business ownership side of things, which adds just another element of experience that I can provide in the dental office. So here's where I get to practice a little bit every day.
We designed our state-of-the-art practice with our patients in mind. It is so inviting when you walk in. Every space is clean, open, and airy, while our treatment rooms feel very personal. You have your own view of a private courtyard. We really want you to just feel like you're at home.
We're a personally owned and operated dental practice, so when you come to see us, you see us. We're not like a corporation office where you see a different dentist every time. Every time you come in, you see Dr. Zittrick or myself, which means you always see the same face. And we know who you are, you know who we are, and we know your past and your history. When we started designing this new office, we literally traveled the world to get a sense of what they were doing that worked, what we liked, and what we wanted to apply here. So we actually designed this office with our patients in mind to give it a sense that no one else in the country has.
We have the newest technology that lets us work more efficiently and keeps our patients more comfortable.
We can actually use a digital scanner to scan your teeth to create a digital model of your teeth, and that eliminates the need for goopy impressions and the molds that nobody likes doing. We use CAD/CAM technology that lets us design crowns and veneers in a single visit, so you don't have to come back 2 weeks later and wear temporary restorations during that time. And we have 3D technology that lets us scan your mouth and actually design your implants with incredible precision and accuracy.
What really sets our office apart is just the care and dedication that our team and our doctors have for our patients. Every patient that walks through our doors is our family, and we really try to just help our patients feel exactly like that, like our family.
We appreciate that patients put their faith and trust in us for their smiles and their care. That's an extension of the faith and trust that we have, that we put in others and in our Creator. We believe that it's our responsibility to not just take care of our patients and provide for them, but to take care of our community and everywhere else we can. So one of the things we love doing is serving others, whether it's in our community locally, around the world. We have dental missions that we've set up in Dallas and as far away as Haiti and South Africa. And we love supporting those missions and actually going there and treating people there as well.
We're not your normal everyday dental office. We really like to have fun here too. That's why we have an interactive art mural on the side of the building. We want patients and anyone driving by to have a platform to express their artistry and creativity too. We absolutely love what we do. We feel that it's a privilege and an honor that patients trust us with their care.
I'm Dr. Michael Fisher.
And I'm Dr. Marissa Zitrick.
And together we are Fisher & Zitrick Dentistry.
We are a family practice with an emphasis in cosmetic and implant dentistry.
So that is just a little bit of where I get to practice every day. Not a day goes by that I'm not thankful to work beside some of the very best doctors that I have in my entire career. So I do all that I do for these people right here. This is my family. I am married to my high school sweetheart. We have 4 kids. I have a junior in high school, and then I have a freshman, a 7th grader, and a 3rd grader. So we are very busy. We're very active. And everything that I do is for our family. Everything that I'm going to talk about tonight, I believe in it wholeheartedly. I wouldn't do it if I didn't think it was good enough for my family. And you'll see my 2 older kids several years ago. We started on their Invisalign journey and completed that here not too long ago. And you'll see a little bit more about them later on in the presentation. So if it's not good enough for our family, I wouldn't talk about it, and it certainly is. And the products that I use on my own children. So I stand behind everything that I'm going to talk about tonight. So we're going to touch on these learning objectives, get through these guys, and this is what we're going to expect for the night. We are going to understand the purpose, types, and characteristics of attachments. And we are going to talk about patient assessment, treatment planning, just evaluating those patient needs, what your treatment objectives should be and what they are, selecting the appropriate attachments to get the optimal results that you're wanting and what the patient is wanting. We're going to talk about techniques for attachment placement, step-by-step guidance on proper bonding techniques, including isolation, etching, bonding, and curing. We're going to talk about troubleshooting because we all know that a lot of the reason why we are here tonight is to figure out why those darn attachments are coming off. And then we're going to talk about safe removal procedures. So how can we remove the attachments without having patient discomfort and to prevent enamel damage? So lots to talk about. We're going to talk about all the materials and the equipment. So there's a lot to get going on tonight. This is the attachment protocol summary that you actually can get from Invisalign or any clear aligner company that you use if they are using attachments. So you can see attachments provide aligner retention. That's one thing that they help provide. They prevent the teeth from tipping, especially in those diastema closure cases. We all know that those teeth can tend to tip on us. So attachments will help to prevent tipping. They allow for root control. The big thing out there is that clear aligners cannot move roots adequately. And we know with proper attachments that we can get root control. They allow for extrusion, and I call them the handle to the coffee mug. And that's my analogy for patients. If we can't grip and lift a coffee mug without a handle, then what good is that coffee mug? And we can't really move it. So we've got to have a handle on the coffee mug. That's what our attachments are doing. So you can see in every situation on the right-hand side that that protocol summary is providing, there are different shapes and sizes and positions of all of these attachments, and each one is designed to do something different. If you are the one placing these attachments, you need to know what attachments you're placing, what they're used for, what's their purpose, what is the shape of that attachment supposed to look like. That's the only way that you can properly place an attachment, is if you know those things. Otherwise, you could accidentally polish off the active surface of the attachment. You could get the attachment in the wrong position. There's so many things that can go wrong if you don't know what you're placing and why you're placing it. So don't get yourself in a case like this. This is a very complex case if you don't know what you're doing. There's a difference in attachments and buttons, and that's kind of a big pet peeve of mine. You'll see in this picture, this is a complex case that we had, and the attachments are the composite attachments underneath the aligner. The buttons are the metal buttons and the clear composite buttons that you'll see in the photo for the elastics. So there's a difference in an attachment versus a button, and that's a very clear distinction that I try to make with even my front office. If they're taking a phone call and a button has come off, I want to know, is it an attachment? Is it a button? Because typically I don't have attachments come off. I might have a button come off for various reasons. So I want to know those types of things. Be specific and know what you're calling things. But know what movements require what attachments. So rotations that are more than 15 degrees, and you can find out the exact rotation on your software. It will tell you exactly what rotation you are rotating that tooth. You can actually set the degrees if you want to change it. But anything over 15 degrees, you need to have a rotation attachment. Extrusion of any kind. Think about it. You can't just pull a tooth down without anything on it. There's no extrusion possible without something to lift or pull that tooth. Deep bites. Deep bites have to have posterior attachments. There has to be a leverage in the back to be able to push down and correct the deep bite. So you've got to have attachments there. And then let the software help you, okay? Let the software tell you where the attachments need to be. It's going to have all the algorithms built into it. It's going to tell you what you need to have. And always use the largest attachments possible, okay? Use the largest attachments possible. You want the biggest grip on the tooth that you can possibly get, okay? So when you're planning for those. So you have this case that walks in and, oh gosh, you know, the immediate response is going to be, let's go straight to perio, which yes, that is a concern, but what are we going to do about this crossbite? You know, why does she have this diastema and this crossbite? There obviously is a tongue and maybe an airway component. So we're going to get wrapped up into this case, but we've got to know what our end result is going to be, how we're going to get there. And it's going to be with the use of not only attachments, but it's going to be the use with buttons as well. This is a very advanced case. This is a case that really needed to go to orthodontics and traditional ortho, but elected not to. And so, you know, obviously we are doing and did our best to get her through treatment and get her to a stable position. She'll never be textbook perfect. That's what my genius orthodontist down the road would get her to. But we did our absolute best with her. Did she have perio? Yes, we treated the perio. We have a world-class periodontist who helped out with that. But we got her a whole lot better. This is a progress picture. You can see, though, that the fit of the aligner and the attachments is key and crucial. Getting those attachments, the right attachments in the right place, the buttons where they needed to be. All of that makes a difference in finishing a case. So when do attachments become ineffective, and who's watching this? Who's tracking this? Because in the clear aligner world, the beauty of it is that it doesn't take a lot of doctor chair time. So the beauty of this is that you are able to select like an Invisaleader or an RDA or a hygienist who can kind of take the lead in these Invisalign cases, and it can be doctor-led and doctor supervised with an auxiliary. But you have to know what you're looking for if you're that person that's monitoring these cases. So attachments become ineffective when the aligner stops tracking. It stops tracking for several reasons. So 3 reasons. Compliance. That's the number one reason why aligners stop tracking over any attachment, over any tooth. The patients are just not wearing them. So we are very stern up front with our patients. They have to wear them 22 to 23 hours a day. And they're like, oh man, that doesn't leave me any time to eat. No, it doesn't. You eat and they go right back in. And I tell patients, you know, you're going to hear, oh, braces work so much better. That's because braces can't come out. Braces stay in. So you have to keep these trays in. Brush after meals and get them right back in. So compliance is number one. And you have to be very artful and skilled to be able to figure out if a patient is not being compliant. I always will charge for additional aligners if it's due to compliance, and patients own up and fess up to it every time. If you don't have enough room, so it's either a lack of expansion or a lack of interproximal reduction. So it's always going to be one of those two things. We always aim in our ClinCheck software to try and get as much expansion as possible before we result to having to do any kind of IPR. Or improperly placed attachments, or it's slipping off the attachment has worn away, the attachment is broken. So many things can be wrong with the attachment itself. If it was never put on the right way to begin with, then we're kind of hosed for the rest of the case. So I'm a huge stickler on attachment placement at the very beginning of treatment. They have to be done well and right. And a lot of doctors may not like me saying this, but I say that whoever's placing the attachments needs to have loops. If they're going to place them and they're going to remove them, they need to have loops to properly do this. So we're going to follow kind of this guide that Contemporary Product Solutions and Shofu put out together. This is a guide that if you've gone to any hands-on course with Invisalign, you will have seen this. We're going to kind of walk through this step by step. But the first thing is you're always going to double check your ClinCheck, double check your attachment placement on your treatment overview, which is on that top left-hand part of your screen. Double check and see where are the attachments, what are we doing as far as movement's concerned, and where are they going, what kind of attachment is it, what kind of movement are we trying to achieve here, is it a double attachment, all of that. Try in your attachment template and then dry it out really well. You're only going to etch where the actual attachment is going to go. Do not etch the entire tooth. If you etch the entire tooth, good luck polishing and getting all your flash off. It's going to be impossible. So only etch. I'll hold my attachment template while I'm looking at the tooth and going back and forth to make sure I'm etching just the location that I need for the actual attachment. Then you're going to place your bond. And Shofu has a great bonding agent that you can use. You're going to air dry that, light cure it. And then you have 2 choices on your composite material. We're going to walk through that here in just a bit. You're going to place your attachment, cure it, and then it's time for flash cleanup. And we're going to go through all of this in detail. So I want you to watch. This is a little bit of an older video. It is pre-COVID, actually. So don't judge me on the PPE. This is actually my husband. But we're going to go over this a little bit as far as attachment placement goes. You'll kind of see the order and the flow, and then we'll go from there. Okay, so today we're going to talk about placing attachments for clear aligners. So I have my patient here, Brian, and we are going to place our Optigate for retraction. I've already segmented my attachment templates. I've segmented off the molars after trying it in, making sure that it fit, because we don't need those teeth on there. They don't have attachments on them, so I went ahead and snipped those off. So I have a smaller template to work with. Just helps keep for better isolation and decreases the chances of the template not fitting correctly. So I'm just gonna pause right here, and when I'm talking about trimming the template, you can cut off any excess teeth. So just double check on your template, but if you only have attachments from premolar to premolar, we don't need the molars on the attachment template. So when I'm talking about segmenting the template, you can either do it in quadrants. Now I've moved to just doing a full arch at a time. I do upper and lower. I'll do the upper arch, and then I'll go down and bond the lower arch. But just cut off any excess teeth that you don't need. That's what we're talking about here.
Have less teeth to work with. So that's the reason why I like to segment my aligners or my templates. We're going to place our Optrogate in for isolation. Okay, so just relax your cheeks. Okay, so now that we've got our Optrogate in, we are going to kind of air dry everything before we place our etch. Close just about halfway. Air dry everything. I'm going to go ahead and place my loops on. And while I'm looking at my template, I will place my etch. So I kind of look back and forth between the two. Just require a small dot of etch just where the attachment's actually going to go. You do not want to etch the entire tooth. If you etch the entire tooth, your flash cleanup will be a nightmare.
So you can see here the video that I am just double checking the template to the teeth. So I'm looking at the template. I'm only etching exactly where the attachment is going to go on the tooth, or not etching the entire tooth.
Just to make sure that they're nice and clean. Brian's already brushed his teeth, so we don't need to worry about that. And if you do pumice, you do not want to use anything with fluoride in it, because that will affect the bond. So make sure it's just a plain pumice preppy.
And right there, I'm talking about making sure that the teeth are clean before you bond your attachments. So he had brushed his teeth really well for me before we went in to do this. You can pumice or polish the teeth. Just don't use anything with fluoride, as it will affect the bond. So that's what we're going over right there.
And while this etch is sitting, I'm going to go ahead and fill my attachment template. I like to use Shofu's Beautiful Fill 2. I use the packable composite. I am not a fan of injectables or flowables.
And so this is Shofu's Beautiful 2 composite that's packable. They do have a Beauty Flow Plus. It's very viscous. It's a very thick flowable. So it doesn't run inside the template. A lot of doctors have moved to that particular composite. So either one of those, and I have some slides on that here in just a bit. Either one of those is great for attachments. And I'll go over why I use those Shofu's composite in general for my attachments. There's so many great qualities. I've used it for almost 20 years and love it. I have had, if I run out and I've had to use another composite while I'm waiting on theirs to come in or whatever, I can tell such a huge difference. And I regret, like us having run out, so I'll go over a lot of those reasons here, but this is the packable. I don't warm it, typically we'll warm composite, like if we're filling teeth for regular fillings, but I like it just regular room temperature, and I'll go through and just fill up the template. I'm going to kind of skip through here. And I've left the etch on enough time to fill the template. And then we're going to place our bond, and we're going to light cure it. And that's just me air thinning the bond.
And what you have to look for is
And at this point, I have placed the template in the mouth. I've got a pair of cotton pliers, and I am just really making sure that the attachment template is fully in place, and that I am isolating every single attachment, and I'm putting pressure all around the attachment edge to make sure that it is completely sealed up against the tooth. What happens, especially if you're using a packable composite and it's not warm, is that template will tend to flare out because of the thickness of the packable composite. So you've really got to make sure you put a lot of pressure to get that attachment template in there, and then apply with an instrument, get some pressure in there to squish the flash out and make sure it's seated all the way against those teeth.
Push back on the template. So if the template kind of bounces back, or the composite is too hard or too dense, it will actually flare the attachment template back out. So you want to make sure that the attachment template is in, pushed down all the way, and that the composite has been expressed in the directions away, so that I don't risk getting.
And then we're going to light cure the attachment. So that is the gist of actually placing the attachments. It's always preferred to work with an assistant. It moves a little bit quicker for an assistant. As far as timing goes for this appointment from start to finish, I give myself about 45 minutes. It doesn't take that long to place the attachments, probably 15 minutes with an assistant. And I am very diligent about flash cleanup and polishing. Most of my time is spent showing them their clean check, reviewing the expectations, and going over all of their instructions. So that's really what a lot of my time is spent doing up until, you know, the end of the appointment. All right, now here's the cleanup. Cleanup is crucial. This is, like I said, where most of my time is spent. I do use a Shofu product. It's their little Super Snap disc. And it's not the disc, it's the cup. I use the discs at the end of Invisalign. So it's their cup. And I use a very fresh, brand new cup, and it will clean up the flash so well. And that's one of the things that I love about the Shofu composite, is that when I've had to use other composites in the past, it doesn't polish off very well. So the great thing about the Shofu composite is, as I'm polishing it off with that white cup, the composite polishes off so nicely. I don't have to push very hard. It comes off really well. And there's no sensitivity while I'm trying to polish. So we're going to go through the attachment cleanup process here just for a moment.
Okay, so
you
now
can kind of
we
see
have
that work.
all of our attachments in place. So we're going to take a scaler and we're going to remove the excess flash. Turn my light back to bright. And so I just use a regular 6/7 scaler. Make sure you have a really nice sharp scaler and a good fulcrum so that you can pop off any excess. Typically the excess is going to come straight to the occlusal. So, you know, always double check those incisal edges. Make sure your patient has safety glasses on and that you have your glasses on, just so that you don't get poked in the eye with some composite.
So first thing here is just using a really nice sharp scaler. If you did not etch the entire tooth, which you should not have, if you just etched the two areas or the one area where the attachment was going, and you just placed bond on that area, then the flash around it should pop off fairly easily. But that is one thing, is I do dull scalers quite frequently, just because I'm constantly scraping off a lot of composite. So you do need someone to keep those scalers nice and sharp. I actually keep a sharpening stone in my room so that I can sharpen them as I'm working. But you know, a sharp scaler goes a long way, and then I'll pick up and just kind of polish off the little jagged edges that I've picked off.
Popping off of these teeth. So we're going to work our way around and just double check.
So I'm going to kind of skip through this.
State.
You'll see how much time I spend doing a lot of the
I'm actually
scaler
using the
cleanup.
edges of the cup.
And then this is just the white cup, and I'll show you that here a little more up close.
Some heat, so I don't want it to be.
And that's pretty much it. We go through and we polish everything. And that's the attachment cleanup process. So we're going to go through this and kind of break it down. I just kind of wanted to show you the overall workflow, and then I'm going to kind of break this down. So we have our attachment template, put our composite inside the template. Then we have the attachment on, but it's got the flash. Okay, so you can see the flash. And we're going to go through, pick off that flash, polish the flash, and then we have our cleaned up attachment. So this is just, again, kind of where we are in our workflow in this process. So here's kind of what I'm using during this process. I like the B1 Shofu composite. I'm loving that shade. I used to use the A2 and I love that too, but I'm liking the B1. It's matching now that everybody's whitening their teeth, and both of them are great. They shade match wonderfully. But I'm starting to really like the B1 for everybody. And then I'm using that one gloss polishing cup. And I'll show you, and those are actually on that chart too, but I'll show you a picture of those. Let's talk a little bit about the composite specifically. So I told you I would break that down. This is the Beauty Fill 2, okay, and it comes in the Flow, which is the really thick flow, or the packable. But it's very polishable. It diffuses light really well. You don't have to like do a bunch of layers. You can not necessarily bulk fill it, but you can fill it quite well. My favorite thing about it is that it releases fluoride and it recharges and continuously releases fluoride. So it's fantastic for like class 5 restorations. If you have somebody that you need to do it with class 5s. I love it because it's, if I've got somebody that is in Invisalign with trays, I want something that's going to continually release fluoride when I'm not there to help brush their teeth, right? So I want something that is going to be really good for them. I want something that's aesthetic. I want something that can polish really well. So some of the downfalls of the other composites I've tried in the past are that they're like super, super, super hard, and it's really hard to get them to polish or to remove them. Or the other composites are really porous and they stain really horribly. They break or they chip. I've had composites that have just been so packed full of like bubbles that, half the attachment shears off. So I literally have used Shofu composite for decades, and I absolutely love it. There's no shade change. So it's great for coloring. And I have patients whiten. I have patients that have been in treatment for 2 years with trays, and they will whiten almost the entire time that they are in treatment, and their attachments do not stand out. So their attachments continually blend because it has a really chameleon effect as well. So I do appreciate that about the Shofu composite. It does have some radiopacity to it, which is great for x-rays if you are placing it in a cavity. And then the strength. So this is just a chart for all of you that want to talk about the strength and kind of make sure that it is strong enough for the needs that you have it for. It doesn't wear. So with my trays going in and out all the time, the composite doesn't wear down. And I love that about the Shofu. It's strong enough for that, but it's not as strong enough, not so strong that I can't polish it. So it's like literally the perfect hardness, if you will. And so I appreciate that. The Beauty Flow Plus is a nano hybrid. It polishes great. And it doesn't, like I said, it comes in like 2 viscosities, a no flow and a low flow. It has great radiopacity. And both of the Shofu composites are very cost effective. So I do appreciate that about their product. But just in general, love the composite, and it's really the only thing that I would use. And all the pictures that I'm going to show you today of my cases, every single one of them has Shofu composite on those teeth. This is the one gloss polishing system. I prefer the cup out of all of them. That's just what I like. They all work wonderful. I have my doctors each prefer a different one. But I like the cup for polishing the attachments. And we actually you can get them where they're all in one piece like this. We actually get them where we get the mandrels, and then we get the little cups that we can slide on and off of the mandrels. And I will tell you, I do use 1 cup per delivery because I want a nice, clean, crisp cup every time I do it. And then the same thing when I take off the attachments, I use 1 cup per attachment removal. Because again, I want a nice, clean, crisp cup, not one that's been doled down. So these are just the different systems and different points and discs that you can get with them for all of your polishing needs. We use these every single day, not only for attachments, we use them for all of our fillings as well in the office. Because they do such a good job at polishing and putting on a nice finish. It's also great because if you have leftover bond on a tooth, or you have composite that you're just trying to remove, you can use these and it will gently remove that, and there's no scratch on the enamel, there's nothing, it doesn't ditch out anything. So they're just really gentle, but yet they're effective enough to do the job. So I have used these for 20 years. I mean, as long as I've been practicing, I've been using this system and love it. And every office I've been to, we make the transition to these because doctors, I'll show it to the doctor and they love them. So let's troubleshoot some attachment issues. And these are my photos. You got to show the good with the bad and the bad with the good, right? So if your attachments aren't sticking, these are some reasons. This is an underfilled attachment template. So new assistant came in and was trying to be helpful and place some attachments, and I had the patient come back and I'm like, well, gee whiz, we never have attachments come off. What's going on? Well, this was the issue. So we underfilled our attachment template in these photos, and you can see the little gaps. So we popped those bad boys off and replaced them. But this is one reason that an attachment can come off, is an underfilled template. If you don't get a good enamel etch, that is a very high likelihood of an attachment coming off. So you've got to have someone, again, I prefer loupes, but you've got to have somebody in there that knows what etched enamel looks like. They can't etch plaque. They've got to know how to isolate. And so you've got to have somebody in there that knows what they're doing as far as an etch looks like. Adhesive. So a lot of times we get in a hurry, and my biggest pet peeve is letting the chair side cure, because the reason I don't like that, I want the operator, the doctor, whoever is in the clinician's seat, I think they should cure, because they have the most direct vision of where the curing light should be. I think that if you have a chair side trying to cure over here, they don't have the best direct vision. They don't have the fulcrum. They don't have the position to be able to direct the light in the right direction that it needs to go in. So you're going to have underfilled or undercured fillings. You're going to have corners of them not cured. You're going to have so many issues. So if we are getting in a hurry and we're just waiting our curing light, or we have someone at the wrong angle or a chair side trying to cure, we may not be getting our adhesive cured all the way. And so then what happens, you put that template in, and then you really do go in and you actually cure attachment by attachment. Now you've essentially glued your template to the teeth. And so you go to try to rip out that template and it breaks off half of your attachments because you've essentially glued the template to the teeth. So we want to make sure that we're curing the proper amount of time for the adhesive and then for each attachment. And then if you are bonding to porcelain or to amalgam, whatever it is, you need to make sure that you have those systems and that you follow them precisely. Especially, I see it all the time with crowns. I do try to avoid placing attachments on crowns if possible, but if I've got to have an attachment or a button on a crown, you either have to roughen the surface of the crown a little bit, and then you've got to go back and polish it after you take everything off, or you've got to get a really good porcelain etch system and get that good porcelain etch. Make sure you see the etch. Don't skip the siling. Get a good bond. Get everything on there that you need in order to get that bond to happen. All right, so I'm going to pause here. There were a couple of questions that I wanted to address. There was one about the Optrogate. There's actually, you're going to see here in just a bit another video of me putting in the Optrogate, and so I'll get that for you. And then there was another question about the button preference, whether I prefer metal buttons or the clear buttons, the tooth colored buttons. I do prefer the metal buttons. The metal buttons I prefer because the elastics hook better to the metal buttons, but I do use the clear buttons the closer to the aesthetic zone that I get. So I will make that transition, and you'll see that in those photos. I've got metal toward the back, and then I'll make the transition to the clear as I move to the front. All right, so let's go ahead and move on to placing, or I'm sorry, to removing the attachments. So this is another guide that is actually on the back of that attachment placement and removal guide that Shofi has put out. There are a couple of different ways you can do this. Obviously, you can do this with the one gloss cup, which I do. You'll see me use that coming up. The other way you can do that is with these Super Snap discs. Love the Super Snap discs. We do a ton of enamelplasty with these guys. They are fantastic. Do a ton of aesthetic polishing and anterior composite polishing with these. Just awesome. I mean, we literally have this kit in every single operatory in our office. So you can actually take those on a low speed and get those attachments removed with that. You'll see that the attachments are traced in pencil. You can trace the attachments in pencil and then go through and remove them that way. So I'll show you my system here in just a minute. You'll also see down below the products used for placing and removing. So you'll see the part numbers and all that good stuff, all your contacts. But Beautyfill Plus, the Beautyfill 2. I don't use the big syringes of the Beautyfill 2. I use the compules. I like that. The Beauty Bond. So there's you can get it in the bottle or the single dose. The one gloss polishers, and then the Super Snap disc. This is like your entire kit that you're going to need for placing and removing attachments. So let's go through some of the products, and then we'll go through actually removing the attachments. I prefer using, we use a fluted carbide burr. We'll actually go through, remove about 90% of the composite. So doctors, depending on your state, if it's a high speed, you're going to need to do this depending on your state. But doctors, you'll go through, you'll remove about 90% of the composite, and then the assistant, or again, depending on state, they can go back through with a low speed, and they can go back through with the white cup, and they can take off the last 10% of the attachment, and there's absolutely no scratches in the enamel. Number one pet peeve is that we always see patients that have been treated elsewhere or have been in ortho, and then now they're going back in, or they're going into Invisalign, and there's scratches all over their enamel. If you use this system with a carbide or with the Super Snap discs, you take off the bulk of it, and then use that white cup. You won't have any scratches on the enamel, and that's key to me. The Super Snap discs, like I said, that's great for enamelplasty. All of our Invisalign patients get enamelplasty at no extra charge. I mean, it's just to finish an orthodontic case and then to be able to provide them beautiful enamelplasty, and it looks like they just got these beautiful veneers, which it's just their own teeth, is awesome. And those Super Snap discs are awesome. I've used those my entire career. And then the Optragate from Ivoclar is fabulous for retraction. So this is just a video to show you kind of the ergonomics of the attachment with a carbide. So we go through, you'll see the placement of the Optragate. So definitely make sure you get the right size. This is a regular, so I use regular and small. Regular fits most people. And you'll see the placement of it. You pinch it in the middle, and then you go side to side, and then you put the interior lips in. And so once you've got that in place, we're going to start with removing about 90% of the composite with our carbide burr. So I'm going to kind of zoom through this video a little bit. So you'll see we're just no water. No water is necessary. We're not doing this on a super high speed. It's just we're going through, we're polishing off about 90% of the composite, never touching tooth structure. And then we're going to come back through with our white cup, which is here. So there's our white polishing cup, and that's taking off just the last little bit. That's done on about between 10,000 and 20,000 RPMs on a low speed. And under loops, no water, you can actually see the tracing of the composite, and as it removes, you can see the enamel coming through the powdery composite. So again, another reason why I love the Shofu composite. I can see as I'm removing it, I see how it gets powdery. I just, from placement to removal, the whole system is what makes this work so well and so efficiently for us. So you can see, and I'll just kind of go through this here. And then when we're done, we go back through with the scaler. We just double check, make sure there's no sheets of composite left anywhere. So we're just double checking everything. Sometimes you'll catch like a little corner or something that you missed. And so we're just double checking all of that. Okay, so there's our Super Snap Disc Kit. I have one of these in every operatory in my practice. It has our little polishing strips that you can use in between the teeth or your interproximal fillings. And then it has a small disc and a larger disc. Depending on the size of the incisal edge is how we use them. So, you know, if we're doing centrals, we're going to have the larger disc out. If we're doing laterals, we're going to have the smaller disc out. Fast and easy, yes, they are. We have little metal mandrels in every room, and we just pop these guys on, and they're fabulous. You can go through, it goes from black to violet to green to pink, and it puts a nice shine back on any composite. It'll actually reshine. So if you have ditched out enamel or scratches in the enamel from someone ditching it out, you can go back through and go through this system, and it'll put the shine back in the enamel, which is awesome. So here's just a before and after that I want to show y'all before we open it up for questions and answers. So this is my son, this is my oldest child. And you can see with the proper use of attachments, I want you to draw attention to the upper right, so the left of your screen, his number 6 and his numbers really 4 and 5. He needed some expansion, and then he needed that cuspid brought down. And so you can see with the use of attachments, we can really do a lot with attachments. No buttons needed, no elastics, attachments only. Here's another case with attachments only, no buttons. This is a diastema closure, and with the proper use of attachments, we didn't get any tipping, and we were able to put these teeth in position. This is a patient who was almost 80, and she was just ready to do something, needed to do something because she was breaking her teeth, and then obviously some enamelplasty with those Super Snap discs. This is an expansion case. Very straightforward for this gal. And again, no buttons, just attachments and some expansion and correcting her deep bite, and a little bit of enamelplasty. She didn't need a ton, but we did give her some enamelplasty. So if you want to take a picture of this, this is kind of my ClinCheck setup. And if you, at the end, I'll give you my contact information. But this is how we set up our ClinChecks to get the results that we're getting. And I will say there's not one proven strategy to get you where you're not having to do a refinement. Okay, we're OCD, we're picky. I'm going to do a refinement until until the cows come home, if you will, because I want things perfect. Unless the patient's like, yeah, I'm good, I'm done. But this gets us as close as we can be. This is a protocol we've been using. We developed it about a year ago, almost 2 years probably, and it's helping a lot with getting us really, really close to not needing refinements or additional trays. So if you want to take a picture of this, or you can get my contact info and I can send it over to you. But this is how we set up our ClinChecks. And basically, the whole point of it is you kind of have to shift your mind on the ClinCheck. You have to go, okay, if this is my end result, I'm trying to put the pressures on the teeth. I want to put over correct pressure. I want to put too much pressure on the teeth, get them where I want them to be. The ClinCheck may not look perfect. So if I have 2 teeth that I'm trying to, rotate, I may need to over rotate them, which means in my ClinCheck in the final tray, they may look like they're now crooked again. But in reality, it's the extra pressure that I needed to actually get them to land where they were supposed to land. So we've been telling the software to overcorrect teeth by 3 degrees, or we've been telling it to do that for years. but now we're just exaggerating it a little bit more, especially in deep bites, to really try and get those deep bite corrections. Follow this, it's been helping us, and I think it'll be a help to you. All right, so I'm gonna kind of get up here and we're gonna go to some questions. Copies, yes, you can contact me if you need copies of anything, and we'll be happy to get that for you. We did the Optigate. The one gloss polisher is similar to enhanced points. Yes, I don't know exactly what they're made out of, but I would say I prefer the one gloss polishers just for general like composite polishing to anything else. So that's kind of my protocol for that. So for zirconia crowns, I have not found anything that bonds really, really well to zirconia crowns. I actually just try to avoid putting attachments on zirconia crowns altogether. But I would just stick with the zirconia, you know, if you can find a zirconia etch and bond system, I would go with that. The brand of the metal buttons that I like to use, you can get them through any orthodontic company, so you can get those anywhere. They're just a metal button. And then the carbide burr is run at 40,000 RPMs, sometimes lower depending, you know, if you have a sensitive patient. If I have patients that are super sensitive, like every now and then because they've been whitening or whatever, then I will have them do some desensitizer for about a week prior to removing attachments. I do not like the idea of using a greenstone to remove attachments. I would not do that. Now you have a new system you can use. We just went over that. Elastics, so elastics depends on the strength. So I prefer latex elastics. Those are stronger than non-latex. Non-latex are a lot fatter. They're really hard to get to hook onto those clear buttons. So I prefer latex if you can use it. And as far as strength goes, it depends on what you're trying to do. If you're trying to, you know, if you're doing like an up and down, or if you're just doing like a class 2 or a class 3 elastic, that's all going to depend on what you're doing as far as what strength you're using. So my go-to is usually like a 3/16, but it just kind of depends on what you're doing and how many times you're wanting them to loop the elastic. The percentage of time that I have to do refinements, and because I'm so picky, I probably do refinements 80% of the time. And I always tell patients to expect, you know, if I realistically know the case is going to be 9 months, but we're going to do a refinement, I'm going to tell them 12 months. And I always tell them, like, their biology, the way their teeth move, no computer can predict that. Invisalign has treated millions of cases, tens of millions of cases. And so they put all that data in the computer, and predictably, we think that teeth move 1/4 of a millimeter per tray. But there's a lot of factors to that. How often are they going to wear them? Are their teeth going to move? Is anything ankylosed? Or do they have root canals? There's so many things that go into that. Do they have short clinical crowns? Because that's a killer on getting teeth to move. So, you know, I always guarantee there's going to be a refinement. And then if I don't do one, yay, everybody's happy and we're done. We're done early. So, is there any way to polish around the buttons without using a handpiece? Assistants can't use hand pieces in the mouth. Doctors won't come in for polishing. So no, there's not. So what you could do is just do a lot of scalar cleanup. There's really no other way outside of polishing with a slow speed. Double check the state that you live in, because attachments are a temporary restoration, and because you're using it at a low speed, it is possible that you could use it there, but don't quote me on that because I don't know where you live and what the laws are there. So double check with your board. But you know, if the doctor can pop in literally for 2 minutes and polish, and you've done all the scalar cleanup, I think that maybe you could work a deal out with them to do that. It is their patient. And then, do you apply pressure on the trays when light curing? That's a great question. I will only apply pressure on the trays if I'm having trouble getting the tray to stay up against the tooth for whatever reason that might be. Otherwise, no, I don't want to apply a lot of pressure because I've already worked the tray down with my instrument. So unless I see it lifting underneath my loops, I'm not going to put a bunch of pressure. I just gently like lay it on top of the tray. If you put pressure, it could dimple and affect the shape of your attachment. So you don't really want to consistently put pressure in certain places like that. And then last question, the trays that put the attachments, let me position. Oh, okay. Okay, so you get an attachment template for placing attachments. The attachment template is the only thing that you should use to place attachments. So if a patient loses an attachment mid-treatment, then you're going to have to stop, pause, and say it's tray 5. You're going to have to pause in tray 5, order an attachment template for tray 5, and then replace the attachment only if the trays fit perfectly. Because the attachment templates are made to keep the attachments in such a specific shape with the active surface and on the specific location of the teeth, you cannot use an active aligner, because if you're not going to put the attachment in the right spot, it's going to predict the tooth to be moved already to where it should be in 2 weeks. So the attachment won't be put in the right spot. The active surface won't be in the right spot. So you do have to use the attachment template, which is a little bit of a bummer because you have to wait for that template to come in. So that's why it's key to get these attachments to stay on the first time. I can't tell you the last time I had attachments come off. I mean, it's so important to get your isolation and get your etch and your bond down. So, okay, I think we can use monobond to bond the zirconia. There's your bonding agent that you can use for zirconia. So there was a question or an answer to that. I'm going to open this back up and give you my contact information. So thank you guys for having me tonight. I know there's some more information coming to you as soon as I'm done. So there's my contact, and I'm going to turn it back over to Catapult so that they can give you what you need to do now.